to follow whatever weight-bearing restrictions that your surgeon has prescribed. Non-weight-bearing means you're not allowed to put any weight on your foot. If you're using crutches, always make sure that they're the proper height and lead with the crutches first, then your body. If you have arthritic hands or you just find using crutches very difficult, you may be better off with a wheelchair, or you may want to consider renting or buying what's called a rollabout device. Insurance companies typically won't pay for these, but they may be well worth the investment. If you're partial weight bearing, then you'll place your foot in a normal position in front of your body, but you'll distribute part of your weight to your crutches or walker. Whether you have a surgical shoe or a surgical cast boot, if you're allowed to put weight on it, you should try to match the same height of shoe on the opposite side to avoid imbalance that can lead to hip and back pain. The cast boot heel can sometimes be quite high, so you may want to try a clog type shoe or a wedge heel or a tennis shoe with a generously padded heel on your opposite foot to match that height. The heel on the walking cast boot is typically rounded and acts somewhat like a rocking chair. You want to simply place the heel down and let the boot roll you forward into propulsion. Now let's talk about your post-operative medications. Narcotic pain medicine can tend to make most people a bit tired and forgetful, so it's important to keep track of the time and amount of medications that you're taking by writing it down. Many narcotic pain medications also contain acetaminophen. That's the same ingredient as Tylenol. The maximum amount of acetaminophen an average size adult should take in a 24-hour period is 4 grams or 4,000 milligrams. So please be sure to pay attention to how much you take and avoid exceeding recommended amounts of any medication. Most narcotic pain medications will make most people extremely nauseated if you take them on an empty stomach. Always take pain medication with food. Antibiotics work by disrupting the replication cycle of bacteria. So if you're taking antibiotics, it's extremely important to take them at appropriate time intervals in order for them to be effective. So again, write down the time that you took the medication and space them out according to the instructions. If you didn't get a prescription for antibiotics, don't worry, not everyone does. You may have received a prophylactic dose of antibiotics through your IV when you were in the hospital. If you were told to take an anti-inflammatory medication such as ibuprofen after your surgery, or if you were given a prescription strength ibuprofen, please keep in mind that the maximum adult dose of ibuprofen is 3,200 milligrams in a 24-hour period. Only take anti-inflammatory medications after surgery if you were told that it was okay to do so, and always take these types of medications such as ibuprofen with food to avoid GI complications. Sometimes after surgery, the sleep cycle can get a little disrupted. Also, many patients tend to experience more pain at night due to the lack of distractions that are more typical during the day. If your physician wrote you a prescription for a sleep aid, take it if you feel you need it. If you think you're having an allergic reaction to any of your medications, such as a rash, stop taking the medication and contact your physician's office. Have your pharmacy number on hand so that your physician's office can call on a replacement medication if needed. If you think you're having a life-threatening reaction or emergency, call 911. Don't underestimate the importance of good nutrition. Your body needs plenty of high-quality protein, vitamins, and minerals in order to heal effectively and efficiently. Try including fish, eggs, nuts, spinach, beans, and a variety of colorful veggies. Narcotic pain medication can and often does cause constipation, so be sure to add prunes and apples to your diet and stay well hydrated. Antibiotics can disrupt the normal healthy bacterial flora within your gut, so add Greek yogurt that has live and active cultures. Most American yogurt is loaded with sugar, and you don't need that, especially if you have diabetes. Go for plain Greek yogurt that's high in protein and calcium. Always remember, if you have any questions or concern, your surgeon and your surgeon's staff will be happy to answer them for you. Thank you so much for joining me. I wish you all the best in your recovery.